we're so glad you're here to join us for this webinar, Puppy Parvo Protocols, Understanding Canine Parvovirus. My name is Shelley. I am the content manager at Revival Animal Health. And during this webinar, we have Dr. Marty Greer joining us. She is Revival's Director of Veterinary Services. Dr. Greer will be talking about one of the most serious and contagious diseases affecting puppies. She's going to talk about how to recognize early symptoms, understand how parvo is spread, explore treatment options, and discover the most effective strategies for prevention. Dr. Greer brings more than 40 years of veterinary experience to the table with a passion for canine reproduction and pediatrics. She earned her Doctor of Veterinary Medicine from Iowa State University in 1981 and has been sharing her incredible knowledge with Revival since 2019. So, help me give a warm welcome to Dr. Marty Greer.
Thanks for having me today, and I hope that I can be helpful to people. There's some really important new information, so we're going to go through that first. So we're going to start off with a poll question. Shelley?
Yes. So this is a different poll. Yes, this is a different poll question from the first poll question. So this is, have you ever had to deal with a parvo outbreak? Let's see. And in the meantime, as people are answering, just a reminder, check that chat for coupon codes and all the information from Dustin there. So, okay, we'll end the poll in 3, 2, 1. And here are the results.
Yeah.
Like a lot of
people. So a third of you. Yeah, a third of you have. So let's try to get ahead of that if we can. All right. So one thing that I want to mention is that August is Immunization Awareness Month for humans, but we're going to apply that today to the dogs as well, because it's very important that we remember to keep our dogs current on vaccines and up to date on things so that we don't have any lapses in coverage or protection. So we're going to talk today about the new treatment for parvo, what parvo is, how it's transmitted, what its symptoms are, how we diagnose it, how it's treated, how we prevent it, how we can do titers and nomograms, and what other symptoms could they have that isn't parvo. So very important. So what's new with parvo? And the newest thing is a monoclonal A antibody treatment. It's CPMA for short, canine parvo monoclonal antibody. And it's a very important new breakthrough in treatment. The parvovirus monoclonal A antibody treatment is an antibody that specifically targets the parvovirus. It has on it a little arm that will attach to the cell, and then there's some other technology that this was built. So it's kind of Y-shaped, if you can imagine that. It requires only one dose to treat puppies or adult dogs with parvovirus to cure it. And it is a cure. It's the first time we've really had a cure for a virus in veterinary medicine. It has a very high safety profile, and we may see some significant easing of how much it costs you to treat a puppy or a dog with parvo or a litter of puppies. And it will significantly reduce the amount of time in the hospital, reduce the amount of time that your veterinary team has to work with your puppies. So it's a very remarkable product. And I don't know that I can say enough glowing things about it, because it's really significant. We're going to go through the science behind it. To be clear, it's made by Elanco. I do not work for Elanco. I did do one of the clinical trials for safety studies at my practice. And of the dogs that we treated, 30 of them were my own dogs. So I have injected this product into 30 dogs, all of them healthy, some of them puppies. I had 2 litters of puppies at the time, plus my adult dogs. So that should give you some idea of how comfortable I think you can be with this new product. Is I gave it to everybody at my house. It was about 3 years ago, because the one little female that I kept, she's 3.5 now. So it's a pretty remarkable product. And we're going to show you what the studies indicated. So this is a graph that shows you survival of the puppies that had parvo. So they took a group of puppies, 28 puppies. They gave half of them the monoclonal A antibody. The other half did not get any treatment. The blue line shows you how many of the puppies survived that had the parvo treatment. And the answer is 100%. That's the blue line with the little triangles on it. 100% of the puppies that were inoculated with a nasal spray of parvovirus, that was how they introduced the disease into the puppies. They gave them a nasal spray of parvo. 100% of the affected puppies or infected puppies survived. And you can see that 40% of the puppies not treated survived. So 60% of the puppies died with the same exposure to a virus. So this gives you a pretty great idea of how important and how significantly this treatment can change your treatments. This graph shows you what the fever looked like. So essentially, they started to see the virus shed 4 days after the exposure. So after they gave the nasal spray, 4 days into it, the puppies all started to shed viral particles in their feces. You can see that on the control line, that most of them ran a higher fever and ran a fever for longer than the blue line, which are the treated puppies. So they all ran a fever, but not all of them got as sick as the ones that ran a fever and were not treated with the Parvo antibody monoclonal. Here's another graph that shows you the severity of diarrhea that lasted more than 2 days. Only 14% of the puppies that were treated had severe diarrhea, while 71% of the untreated puppies had it. And 10% of the treated puppies were vomiting, but 43% of the controls were vomiting. So you can see that even though the puppies were still somewhat clinically ill, no one got as sick and not as many puppies got as sick with the treatment as with the non-treated group. And here shows the white blood cell count. And it's really important that you understand that white blood cell count plummets with a puppy with parvovirus exposure. It drops significantly after exposure because of the way the virus replicates. So the white blood cell count goes down, the virus particles replicate in the intestines and cause the intestinal lining to slough, which is why we see bloody stool. There's a whole series of things that happen with this, but essentially the virus affects the most quickly dividing cells, which are the intestinal lining and the bone marrow, the white blood cells. So we can see that the virus attacks the cells to the point that the white blood cell count can't keep up. So even though the puppies that were treated had a lower white cell count, nobody got as low or as sick as the blue treated puppies. So the untreated puppies were sicker with a lower white blood cell count. And a low white cell count is one of the ways that we can determine if a puppy actually has parvovirus. And we'll talk about the diagnostics here in a few minutes. And this summarizes all of the things. The red, again, is the control group, so the puppies that got the virus without any treatment. And the blue lines are the ones that were treated with the monoclonal A antibody, the CPMA. You can see that the severity of diarrhea for more than 2 days was much less. You can see the severity of how low the white blood cell counts was much more profound. With the untreated puppies, they ran a fever, they were more lethargic, they were more likely to not eat, they were more likely to vomit, and they were more likely to show positive on the fecal parvo test. So important that you all understand that there are big differences between the treated group and the control group. Expected outcomes, I think, is really important. If we don't treat with the antibody in the old way we used to have to treat parvo until like 2 years ago, it required hospitalization in a 24-hour, 7-day-a-week hospital. Most of the puppies stayed in the hospital for 3 to 5 days on IV fluids with supportive care, antibiotics, medication to control their vomiting and diarrhea, support to get them to eat and drink. It was really hard on the staff to take care of puppies. There was a great risk of cross-contamination. So it was difficult to keep the puppies from spreading from their ward to another ward if another puppy came in. And the unpredictable cost was pretty high, as you would spend thousands of dollars and not be assured that you were going to have a puppy that survived at the end of all the treatment. It may have been that they died from a low white count. They may have died from intestinal disease, but many of these puppies, 40 to 60% of these puppies would die from parvo. The expected outcomes with the antibody treatment, with the new treatment, is 1 intravenous dose, very effective. 100% of the puppies survived. The puppies got better faster. They never got as sick. Many puppies are now on protocols that they don't even end up staying in the hospital, or they may stay for 4 to 6 hours to get IV fluids, but not be kept in an overnight hospital. So many of you may have a clinic that's close to you that you can do daytime hospitalization, but not overnight care. So the puppies can go home much more quickly. So I'm been around for a bit, and parvovirus was discovered in 1978 to 1980 is when it really came into its own. I graduated from veterinary school in 1981, and that was when we didn't have a vaccine for parvo. We didn't know how to diagnose it very effectively because we didn't have a good test for it. We basically diagnosed it on a low white blood cell count and clinical signs of bloody diarrhea, vomiting, and really very sick puppies. Adult dogs also got sick because at the time we didn't have a vaccine. I remember being in the veterinary clinic at Iowa State, where I went to school, And we would have dogs that would come in for a broken leg or for kidney failure, and they would get parvo in the hospital and they would die because we didn't have any diagnostics and we didn't have any isolation and we didn't have any vaccine for it. I remember vaccinating the first dogs that I ever vaccinated for parvo. We were actually using a feline vaccine. You would never do that today. But when we didn't have any parvo vaccine available to us, those were the only choices that we have. So we've come a very long way in 44 years of treating and managing parvo patients. So I want to be really clear how game-changing this is. It used to be we would put puppies into an isolation ward. It would be in a cold basement because we didn't have anywhere else to put them, or on a cold porch because we didn't have anywhere else to isolate them. We'd wear boots. We would wear, it was horrible. I mean, these puppies were really, really sick, and it was very hard on the staff and the doctors to see how sick these puppies were and to know that half of them were going to die. It was terrible. Our treatments for vomiting weren't good. It was really rough. So we've come an incredibly long way between the vaccines and the new treatments. So what can we use the monoclonal A antibody for? First of all, it was developed to treat puppies that were sick with parvovirus. So puppies that are already showing clinical signs, they're shedding the virus in their stool, they're positive on a parvo test, their white blood cell counts are low, they're vomiting, they're having diarrhea, they're running a fever, they have bloody stools, they may be vomiting. Those puppies always can be treated with the monoclonal A antibody. And the sooner you treat, the better. Instead of saying, well, let's treat conservatively with this old treatment, saying, well, let's put them in the hospital for 2 or 3 days and see what they do. No, the first thing that we're doing now is immediately administering this one intravenous dose of medication, probably some fluids, probably some other supportive care. But this is meant to treat sick puppies and sick adult dogs if you have a dog that either wasn't vaccinated or didn't respond adequately to their parvovirus vaccine. But there's also an off-label use that you may speak to your veterinarian about. Say you have 2 litters of puppies at your house, 1 litter gets parvo, the other litter is exposed to that litter because you're in the same kennel. You may talk to your veterinarian about treating those exposed puppies preventively with this monoclonal A antibody. And it's got some specific indications for how that can be used. And I'm not going to cover those because that's really a veterinarian discussion. But we are treating those puppies with a lower dose. We're treating it in a different manner. So it is an option for you if you have had parvo recently in your kennel or currently have it, and you have puppies that you need to protect. So what's new about it is it's intravenous. It's called CPMA. It is shipped in a styrofoam box on dry ice. It has to be kept in a deep freeze, not a chest freezer. I mean, not an upright freezer, a chest freezer. And we got some of the first doses in because we were, like I said, doing a clinical trial on it. And so I've had the opportunity to administer this to many dogs. After it's been made up for more than 20 minutes, you should not be using it. So it's very specifically frozen until ready for use, administered intravenously right away. And these are some of the reasons that your veterinary clinic is the only place that you can get this. You can't buy this. Revival can't sell it. No distributor can sell this other than directly to a veterinarian. So you're going to need to be working with a veterinarian. This is a good reason to have a great relationship with a veterinarian that can help you with this, is to have it available. There is a really small possibility of an allergic reaction because it is an antibody, but the reports are incredibly small. I did not see any reactions in my dogs. We gave it intravenously to half of them, subcutaneously to the other half. Very easy. And Elanco, the company that makes this, does have information on where a veterinary clinic is available. If your vet clinic doesn't have this, if the emergency clinic or your regular vet says, I'm sorry, we don't have it, but we need it today. If you call Elanco, you can oftentimes find it within driving distance of where your puppies are. And we have actually shared it with other veterinary clinics in our clinic. If somebody calls and says, do you have this? Of course, I'm going to say, yes, please come and pick it up, because not every clinic feels that they have enough incidence of parvo to keep it in their freezer. It's not an inexpensive medication. But so some vet clinics are reluctant to stock it because of the cost. But if it's available to you within an hour or two's drive, then you leave the puppy at the vet clinic. They start the fluids, they start the treatment. You hop in your car and you drive to pick it up, bring it back frozen, and your veterinary clinic can then administer it intravenously. It does not have to be given with an intravenous catheter. If you have a really tiny puppy, like they're itty bitty little 1-pounders, and you can't get a catheter, and you can give it intravenously just with a butterfly catheter. So it can be done that way. Is it expensive? It depends on the size of the dog. If you have a litter of puppies that weigh 2 pounds apiece, 1 vial will treat 5 puppies. That makes it pretty cost effective. If you have a 40-pound adult dog that has parvo, it's going to be a good deal more expensive, but it's still not nearly as expensive as putting puppies in the hospital, putting dogs in the hospital on IVs, keeping them overnight, giving them plasma, doing all the other things. So it's still very cost effective by comparison, because it's so much more efficient in the way that it treats the disease. So this is basically how it works, is it's in the monoclonal A antibody. There's a constant region and then a variable region on the little Y-shaped molecules, and they basically attach to a cell at the receptor where the parvo would normally enter the cell and block the entrance of the virus into the cells of the dog or the puppy. So they kind of float around and they block these receptors, and this is how all monoclonal A antibodies work. Now, monoclonal A antibody is kind of a new drug class to veterinary medicine. On the human side, there are over 500 drugs that are either currently approved, have been put on the market and pulled back off, or are under investigation research to treat this. So some of them I see commercials for this on TV all the time. I'm like, oh, Humira, Skyrizi. I've heard of those. Keytruda treats a number of different kinds of cancer. Humira treats arthritis, Crohn's disease, psoriatic arthritis. Skyrizi treats asthma, Crohn's disease, psoriatic arthritis. There's a whole array. If you Google, look at, show me a list of all the human drugs that are monoclonal A antibodies, it literally brings up a list of 500. There's things for Alzheimer's. I mean, there's some pretty impressive drugs in this class. So this isn't a new class to medicine. It's a new class to veterinary medicine. Cytopoint is the one that we've had around for a few years. That's a drug that's made by Zoetis for dogs with allergies, but we also have Librela and Silencia for dogs and cats with arthritis. So those are on the market as well. So a little bit about me is I've been around for a while. I have 4 veterinary clinics. I raise Pembroke Welsh Corgis and Danish Swedish farm dogs. I'm married to this guy sitting in the chair. The photographer actually took the picture without his head on it, so I didn't just cut it off. That's her responsibility, not mine. But we have a drive-through veterinary clinic, 3 other clinics. I also have a law degree. So we do a lot of interesting things in our practice and in our lives. This is a Danish Swedish farm dog. This is Millie. Their ears are not normally upright. They're normally a flop-eared dog, but when she's going over a jump, then there she is. She's got ears that are flapping in the breeze. So this is Millie, the #1 farm dog in the country right now. If you're interested, go take a look at her Facebook page. I don't own her, by the way. And this is our veterinary clinic in Lamira. This is the clinic that Seaman built. We've worked extensively with breeders, so I have a lot of experience in treating parvo and a lot of other diseases that we're either going to talk about in the future or have talked about in the past. And I'm going to just give you a teaser that next month, when we talk about respiratory disease in canines, I'm going to talk about a disease that you've never even heard of, but is out there. So pay attention and hop on that call next month. All right, so parvovirus, like I said, it was discovered in 1978. It came into being in the late 70s. Dr. Carmichael at Cornell at the veterinary school is actually the veterinarian that discovered what this actual virus was. We thought initially, I remember working at a vet clinic in 1978, and we would have these really sick puppies come in with bloody diarrhea. And we thought it was coccidia because that was the only thing, or maybe hookworms. That was the only thing we'd ever seen before that looked like this. It was a whole new virus. It probably or potentially mutated from cats from panleukopenia. So it's a very similar virus to that. And puppies get just as sick as kittens do with panleuk. They get really sick and they can die very quickly. So it wasn't coccidia. It took a lot of work to try and figure out what this was. And if you're interested in looking at a number of resources, I'm going to share this link with you. And this is the University of Wisconsin Shelter Medicine guidebook for parvovirus. It's got some brilliant information in it. And it doesn't matter if it's a shelter or a breeding kennel. You all have populations of young dogs in that facility that you have to worry about keeping from picking up any viral diseases. So it's very important that you know that there's a lot of similarities between those, and the information we can share on one side, we can share on the other. So please don't look at the other group of people and say, well, that has nothing to do with me, because anytime you have groups of young dogs, a shelter or a breeding kennel, you have similar situations. So how is parvovirus transmitted? It's transmitted through saliva, through feces, through direct contact with other dogs. How long does it stick around? And we think it probably lives in the environment for over a year. That's a really long time. So if you end up with this in a facility, a kennel or a shelter, this is a disaster, because this is very hard to get rid of, and it's a real challenge. There are some disinfectants that do a pretty good job of treating it, and we'll talk about that. Back in the old days, all we had was Clorox. We didn't have some of the other disinfectants. And when I worked at a vet clinic back in the 80s, a client would come to the door. They would open the front door very cautiously and put their head in without their dog. And if they could smell bleach, they would turn around and leave, because they knew that meant parvo was on site. and they were not about to bring their dogs into the clinic. So Parvo is killed by Clorox. We used to use that exclusively, but we have some better disinfectants now. So poll question number 2, Shelley.
Yes. Poll question number 2, which of these could be symptoms of parvovirus? Select all that apply. So vomiting, diarrhea, low white blood count, fever, lethargy, not eating, pain, or death. So make your selections here. And as we do, just a reminder, Dustin is adding all sorts of information in the chat that Dr. Greer is talking about, including that coupon code. If you missed the beginning, there is a coupon code for Parvo25. That's the code to get 10% off Parvo prevention products. So make sure to check that out. Okay, we'll end the poll here in 3, 2, 1 and share the results. And it's all of these things. So,
Sure is.
yep.
It sure is. It's a nasty disease.
Yep.
All right. So symptoms, vomiting and diarrhea are what most people identify as being most common. There is a very specific smell to the diarrhea. And I hate to say that that's how we make a diagnosis, but it's a pretty, if you've ever smelled a puppy with diarrhea that's from Parvo, you will immediately identify that it's Parvo. I can walk into an exam room and know if I have Parvo in there. Those dogs will try to admit through an isolation ward. And if you do have a dog that you suspect might have Parvo, then of course you're going to want to do so. If you are taking your puppies to the veterinary clinic for routine care, for vaccinations, for whatever, we're pretty careful. We don't want our puppies at our veterinary clinic walking around on our floors, even though we haven't seen a case of Parvo in the practice for quite some time. I don't want them walking around on the floor. So if your vet clinic will allow you to keep them in a carrier, that's great. If they won't, bring in something that you can put on the floor, a wading pool, like a little kid's wading pool, a blanket, something that you can put down so that the puppies aren't directly contacting the floor. Because if a dog in the room prior to them had Parvo and the puppy walks across the floor, then they may have been exposed to it. So symptoms include vomiting and diarrhea, low white blood cell count, fever, lethargy, not eating, and they can be very painful. The abdomen is painful because the GI tract gets so inflamed, it's very uncomfortable. And a fairly high percentage of these puppies will die. The outcome is death from immunosuppression. So their white blood cell count goes down really low. They don't have enough white blood cells to treat anything else. They can have severe vomiting and diarrhea. They can become septic, meaning bacteria can enter through the gut because the barrier is broken, which is why we use an antibiotic, not because the antibiotic treats the Parvo directly, but because it keeps a secondary bacterial infection from becoming a problem. The puppies can be dehydrated. They can go into organ failure. And the parvovirus treatment, 100% of the puppies that had Parvo exposed, but were treated with the parvovirus monoclonal A antibody had diarrhea, but the severity was reduced from 100% to 5%. So very important change. How do we diagnose it? Well, we can do a Parvo test. There's a little test called a SNAP test. You can purchase that. It can be run at the clinic. We take a rectal swab out of the puppy's rectum. We put it in the well and snap the little device, which is why it's called a SNAP test. And then we'll see very quickly, within 5 minutes or so, we'll be able to see that the color change indicates that the puppy has Parvo. You can occasionally see that positive if they've recently been vaccinated, but the difference is it's going to be a much darker blue spot if it's a disease, not the vaccine, and the white blood cell count on these puppies is profoundly low. A normal white cell count in a puppy should be 6,000 to 12,000. When we see puppies with Parvo, the white count can be below 1,000, almost down to 0. So it's a profound change. The other test that you're going to want to do if you have a puppy with vomiting and diarrhea is you're going to want a fecal test to look for other parasites, roundworms, hookworms, coccidia, giardia. You're going to want to look for things like Campylobacter, which is a bacteria that can cause pretty severe problems. Corynebacteria, Salmonella, there's a very large number of bacteria that can cause problems, but those are going to take longer to run the test for. We'll see blood in the stool, and like I said, there's a very specific odor of the feces. It's got this really metallic smell because of the blood. It's sort of like smelling like, I don't know if you were ever a little kid and put a nickel in your mouth, but that you're not supposed to do that. So please don't think that I suggested that you do. But if you ever did, that's kind of that metallic kind of smell that you'll notice. Treatment is going to include the monoclonal A antibodies intravenously at your veterinary clinic. You may get IV fluids. And like I said at the beginning, your vet may put in the IV catheter, give the monoclonal A antibody, put your puppy in a cage or in the hospital for 4 or 5, 6 hours during the day, and then send you home. We will give an injection of Convenia, which is an antibiotic that lasts for 2 weeks. We'll give an injection of Serenia, which is a nausea medication, anti-nausea medication to make the puppies feel better. We may give them an anti-inflammatory if they're really sick, if they're really painful, and then other supportive care like getting them to eat and drink, all those things. Like our electrolyte solution can be a really great tool because it's chicken flavor based. So as soon as they start to feel better, they can really start to drink and eat. So we are no longer saying every dog needs to be in the hospital. If you can afford it and you have one dog, it's still best medicine. If you can't afford it and you have 12 Labrador puppies, and the only thing you can afford to do is go in and get the antibody injection, the Convenia, the Serenia, and sub-Q fluids, and head home, take fluids home with you, take the electrolytes home with you, support the puppies, but you may not have to hospitalize puppies. So instead of these puppies costing you thousands of dollars a piece, which it used to be, we are now down to spending hundreds of dollars a piece instead. Now, I recently had a client that contacted me from Revival that was told by her local emergency clinic that it was going to be a 6-figure treatment cost for her litters of puppies. She had 2 litters. That's really not the price range that this should be in. It's typically going to be in the hundreds of dollars, not, a bigger dog may be 1,000, but not over the kind of money that she was talking 6 figures for 10 puppies. So it should be in a cost range that makes it practical enough for you to treat almost all these puppies, particularly if you're working with a veterinarian that's used this enough times to feel comfortable to say, this stuff really works and I'm comfortable sending you home. The first case that I ever treated with this was a litter of 2 puppies. One had been vaccinated, one had not because she had strangles, but they were siblings. So we treated them both, but we had that puppy in the hospital at 4 o'clock in the afternoon. They came in, we gave the IV injection. I sent them home, and by the time they got home, they lived 2 hours away. By the time they got home, that puppy went home and was starting to eat. This is a tremendous breakthrough. It is totally a game changer in how we treat parvo. Here is the information on treatment. If you want to look at the algorithm, you can look this up. You can Google it. It's no big deal. You don't have to be a veterinarian to do this. And then these are the treatment protocols for shelters. These are listed on, again, the Elanco website. I'm not going to show you everything, but this kind of helps you to understand the differences between hospitalization and not hospitalizing, and the way that we treat these puppies now versus what we used to do is our survival rates are now well into above the 80% range. So there are 5 different ways a disease can be transmitted. It can be direct contact, so nose to nose. It can be fecal oral, meaning the dog picks up something and eats it. It can be aerosol, like sneezing or coughing on another dog. It can be fomite, meaning clothes, boots, shoes, microchip scanners, thermometers, or it can be vector-based, which is going to be some kind of an insect bite, like a flea or a tick. So what are the 3 ways that parvovirus can be transmitted dog to dog? This is a hard question.
It is a hard question. So we'll give people just a moment to answer here our next question. So of those options, what do you think? As people answer here, just a reminder, if you do have a question for Dr. Greer, please put that in the Q&A box. We will get through a few of those at the end, and we'll send Dr. Greer whatever questions don't get answered to answer as well. So if you do have a question, please put those in the Q&A box on your screen and check the chat for some of those resources Dr. Greer is talking about. Okay, we'll end the poll here and see what is it. And here's the answer. Direct contact, fecal oral, and fomite.
Very good. All right. So how does it get into your facility? If people come in that were around dogs with parvo, or they went to the dog park, that can be on their clothing, their shoes. If dogs come into your facility that are newly introduced, they may bring it in. Raccoons are a big source if they're out in the raccoon latrines, which are typically on the fence lines or the tree lines around your facility. If your dogs run out there, roll around, come back in, they can bring it in from raccoons. So prevention is basically keeping the GI tract healthy, meaning trying to do everything you can to prevent diarrhea, because anything that causes diarrhea will increase the risk of parvovirus. So keep them on a diet that creates solid stools. Don't go doing diet changes all the time. Put them on a probiotic. We've got, for instance, Breeder's Edge Nurture Flora, which is made for very, very, very young puppies. Vaccinations, of course, are essential, and good disinfecting practices are essential as well. So when you disinfect, you want to make sure that you remove all the organic material. That means food, that means feces, that means any kind of thing that you can't disinfect. So remove all those, and you may need to use a detergent like Dawn dish soap to get rid of the oils so that the disinfectant can actually work on the surfaces that you're treating. When you're using a disinfectant, we recommend either the wishy-wash or the rescue. The rescue is a potentiated hydrogen peroxide that does a great job of breaking this down. If you can't afford any of those, like I said, good old bleach still works. You just need to use it at the correct dilution. And bleach is not good for a long period of time. Once it's made up, you need to only use it for a few hours and then discard it. Bleach is at a 1 to 10 dilution, so 1 part of bleach to 9 parts of water. Rescue, wishy-wash, those are all going to be based on what kind of product you're using. If you're buying it in a barrel, if you're buying it in the wipes, they're all different. So make sure you're reading label directions. And if it tells you to put 1 ounce into a bucket of water, a gallon of water, measure the water, measure the ounce. Don't just kind of go glug, glug, glug and think that's close enough. Follow label directions. You do not want to mix disinfectants. So don't put bleach with your rescue. Don't put bleach with other things. Only use the disinfectant that you're using and use it at the correct temperature and time contact. So bleach, for instance, if it's cool weather, you need to leave it in contact longer than if it's warmer weather. So follow the directions. There's information on the internet about that. And make sure it's down long enough that you're not rinsing it off if it says to rinse it before the contact time. So if it says 5 minutes, set a timer and do 5 minutes. Don't put it down and then go off and do something else. I mean, it can be longer than 5 minutes, but it shouldn't be less than 5 minutes. Vaccine basics, of course, vaccines are absolutely essential to preventing parvo. It's our very best prevention ever. Yes, you can use the monoclonal A antibody if you end up with it, but please don't rely on that. Rely on your vaccines. So my questions are going to be, are more vaccines better? So if you vaccinate every week, is that better for your puppies? And the answer is absolutely not. You should not vaccinate more often than every 14 days to 21 days. So 2 to 4 week intervals are typical for most low risk situations. If you're in a high risk situation where you've had parvo, if you have dogs coming and going, if you're at risk of parvo, then you want to vaccinate every 14 days, but not more often than 14-day intervals. More often than that actually suppresses the immune system. What is the optimal frequency? 2 to 4 weeks, depending on the situation. Where do you administer the vaccine? I always go over the right shoulder, not in the middle, not in the nape of the neck, but over the right shoulder on my distemper and parvo vaccine, so that if I have a lump or a spot that reacts, I know that that's from the vaccine. How do I keep track of that? Well, I know, but I always put it in my medical records. And is it okay to use an expired vaccine? I mean, like, it's just sitting in the fridge, right? It's okay. The answer is no, it is not. Vaccines are modified live little creations. And if you leave them in the refrigerator for so long that they're no longer active, the vaccine doesn't actually give you any protection. How should vaccines be shipped and stored? They should be shipped with a cool ice pack. They should be immediately unpacked when they get to your home, and they should be stored in your refrigerator. Very important that you're doing all those things correctly. So more vaccines are not better, not more often than every 14 days. You want to track where everything is. Don't use expired products. And then in your refrigerator, you should be putting the vaccine at the back of the refrigerator, not on the door. So put it in the back of the fridge and put a thermometer in next to it to make sure that your temperatures are correct. Don't let the vaccines freeze. That's the other reason to have a thermometer in your fridge, is to make sure it's not too cold. If it's outdated, throw it away. Consistently use the same spot on every dog so that you know where it's been given. And don't over vaccinate your bitches. You don't have to vaccinate them twice a year. Once a year should be plenty. And if you hear of an outbreak of something like parvo, 2 years ago in Michigan, there was a big outbreak of parvo. Pay attention to that. So if you're hearing that in the news, be sure that you're boostering your dogs if they need to be vaccinated. Now, not all vaccines are created equal. There are new technologies, but the modified live vaccines seem to produce better immunity than some of the recombinant RNA vaccines. So be sure that you're using a modified live, and talk to your veterinarian about what products that you should be using. If you're buying a vaccine that needs to be reconstituted, this is how it is done. You get 2 vials, one with liquid in it and one with powder in it. You pull the liquid up in a syringe, you put it into the stopper, and the vacuum in the vial will usually pull in the fluid. Then you want to make sure all the fluid goes in, then you roll it, and then you pull it back out once all the particles are dissolved. So you don't want to leave any particles in the bottom, and you want to pull it all up into the syringe. So make sure you get every little drop out of it. There's that little stopper in there with a crack in it. So slip your needle in so that you get all the vaccine. And remember, 1 dose of vaccine is 1 dose of vaccine. You should not split vaccines between puppies. I don't care if you have 2-pound puppies. 1 dose of vaccine is 1 dose of vaccine. Do not split it up. Make sure you use the full amount. So when you're vaccinating, we at our practice will set up 2 X-pens with the waiting pools so the puppies aren't in contact with anything on the floor. We can disinfect these waiting pools. And when we do our vaccinations, we have a table. So the puppy comes out of one pen onto the table, gets its examination, gets vaccinated, microchipped, dewormed, and then into the second pen. I've had too many times where people are like, oh, I can tell which puppy is which. That's the one with the tan collar. And then they go, wait, is that tan or is that gold? I'm not sure. So I don't commingle the puppies. They go from one pen to the table to the second pen. I don't care how well you think you know your dogs. If you have more than 2 puppies, you need to be splitting them up. I actually got a phone call from a Revival client one day that was vaccinating 9 of his puppies, had 8 of them vaccinated, and then his 2-year-old opened the door and all 9 puppies commingled. He didn't know which puppy didn't get the vaccine, and there's no way to be able to tell. So make sure that you're really careful of keeping track of who's where. And when you vaccinate, don't do it as they're leaving the house to go to their new home, and don't do it when your vet is closed. So Sunday morning is not the time to vaccinate your puppies. Tuesday morning is a good time to vaccinate when your vet clinic is open and they can see you if you have any kind of an adverse reaction. The stickers on the vials are meant to peel off, so you can now peel these off. This is an old label made by Fort Dodge. So this is a long time ago that I took this picture, but they peel off and then you can put them in your records. If you have those folders, you can put them in there. If you keep sheets of paper on the puppies, anything that you do. Otherwise, at least take a photograph of the lot number and serial number, the expiration date. So if there is an adverse event or anything that happens, you can go back and report that to the vaccine company. Low risk puppies, like I said, if you're in a low risk situation, every 6 to 8, I'm starting at 6 to 8 weeks and then going every 3 to 4 weeks is fine. So if you're in a small number of puppies and you have a pretty safe facility and you haven't had parvo, this protocol is fine. 3 vaccinations, maybe 4, with the last one being given now at 18 to 20 weeks of age. We used to say 16 weeks was old enough, but some of these vaccines are producing such good immunity in the mothers that now we're not seeing the puppies antibodies level drop enough until they're 18 weeks old to start to respond to the vaccine. And if you have any question about it, then you can do titers on the puppies at this age. 2 weeks after their last vaccination is when you want to do that blood test to titer them to see if they've responded. We'll talk about breeds here in a second. And then they get a booster 1 year later, and then they can typically go to a 3-year schedule if they're in a low risk situation. If you are in a high risk situation, like here, we've got multiple litters of puppies. Again, this is at our facility, we've got groups of puppies that come in. We want to perhaps go as early as 4 weeks, but the label says 6. Be aware of that unless you're being directed by a veterinarian, you should not go below 6 weeks of age. And then every 2 to 3 weeks until they're 18 to 20 weeks old, and then booster at 1 year, and perhaps 1 year intervals if you're in a high risk situation. So this is my typical vaccination recommendation for the average low risk kennel is we can start Bordetella if we need to at 3 weeks, but we start deworming at 2, unless the female's been on fenbendazole, and we're not going to go down that path because we've talked about that 100 times. And then, so we vaccinate typically every 3 to 4 weeks until they hit that 16 to 18 week mark. And then at 15 months, which is a year after that one, and then annually for some of the vaccines, but not distemper, parvo, lepto, Lyme, Bordetella, and influenza should be every year. Distemper, parvo can be every 3. And this is the other way to look at it is which vaccination do I give at which age? So Shelley has these in the vaccine notes. If you want to take a look at those, we did a webinar on vaccines so that this information is in those notes. So after monoclonal A antibody treatment, however, that changes our vaccinations because these puppies will have immunity for 17 to 20 weeks post-treatment. So if they were 10 weeks old when they got treated, it may be another 20 weeks before they'll actually respond to a vaccine. And we know that from the clinical trials that we did, some of them on my own dogs, is we know they have a very long immunity, so they won't respond to the vaccine because it basically blocks the response. So it's important that you know that. But you still need to do the distemper, you still need to do lepto, you still need to vaccinate for all the other things so that you don't end up with dogs that end up with, heaven forbid, distemper, influenza, some other disease. So why do we have to give multiple vaccines? And the answer is because until the maternal antibodies that they get from their mother through the colostrum drop below a certain level, their body won't respond to the vaccine. It's going to just get into their system and their immunity is going to go, we've already seen you, we don't need to react. And so they simply don't react. This is why babies get multiple vaccines. This is why puppies get multiple vaccines, is your immune system doesn't respond while you still have maternal antibodies. And it's really impossible to guess which puppy is going to be which. There's no way to know. So unless you do blood tests on every dog, which most people don't do, it's really not very practical to do a titer on every dog, is we don't want to take any chances. So it's better to give additional or 1 or 2 vaccinations than it is to have a dog that's unprotected. As one of the other things that you can do preventively, besides vaccinating for parvo, is if you give Albon, which is an good drug it's an antibiotic, it does good things for coccidia. If you give it for the last 3 days the puppies are in your care and the first 3 days in the new care, it will stabilize the gut bacteria and reduce the risk that they get parvo. Like I said before, any dog that has diarrhea is more likely to get parvo simply because their GI tract isn't as healthy, and so it allows parvo to enter. Here's the information about raccoon latrines. There's actually a CDC website about this. You can go on here. Raccoons will live on your fence lines and your tree lines around places that are out in the rural communities. I live out in the country. I have to worry about this stuff. So if your dogs go running out, hang out where the raccoons, and a raccoon latrine is exactly what it sounds like. It's where they go to urinate and defecate. So their stools will have parvo, they'll have lepto, they'll have all kinds of bacteria and parasites, nasty stuff. So if you have raccoon latrines around your property, you need to get those cleaned up because it's going to lower your risk of parvo, lower your risk of lepto, lower your risk of rabies, all that stuff. So you need to follow the instructions on the raccoon latrine website from the Center for Disease Control. So important that you know that information is out there. So titers and nomograms are similar, but they're not the same thing. A titer is a blood test to tell us how high is the antibody level to a particular disease. And the diseases that we typically test dogs for are going to be parvo and distemper. Now, there are tests for things like lepto and Lyme, but those detect disease, not protection from vaccines. So I want to be really clear about that. So a titer says you're at a high enough level to know that your body is protected against these viruses. A nomogram is done on the female pregnant or recently pregnant dog that will then predict when you need to vaccinate your puppies. So if you have a line of dogs, if you have a breed of dogs that you're concerned about vaccinating too frequently, and you want to do a nomogram, this can be a very useful way to determine what the maternal antibodies will do to the puppy's ability to respond to a vaccine. Puppies get their immunity from colostrum. People get theirs through the placenta. Puppies get theirs through colostrum, the same with kittens. So those are important things for you to know. So this is how a nomogram will look. If you, and I'll show information in a slide, so don't get excited, of how to order a nomogram. So if you draw blood on your mother dog, but not within 2 weeks of the time she has her puppies, because at that point, all of her antibodies are in her milk and not in her circulation. So prior to 2 weeks before she whelps, or more than 2 weeks after she whelps, you can get a really accurate information. So they do a test for distemper and they do a test for parvo, and it always starts high. And we know that this is going to drop 50% every 2 weeks. And when it crosses below that green line, it's when this dog is going to respond to a vaccine. So in this particular case, as soon as the puppy is 4 weeks old, it will start to respond to a vaccine. So if you tested your mother dog and the lab said start vaccinating at 4 weeks, that's why, that's when they're going to start to respond to a vaccine. The lab is now run by Lori Larson, who is shown in this picture. It's the University of Wisconsin CAVID lab, which is the canine immunology lab. And this is the information. So it's the Companion Animal Vaccines and Immunodiagnostic Service Laboratory, CAVID. It does the titer testing. And if you get the form, you can download it from her website. And if you mark the little box that says nomogram, then she will interpret this and tell you how to customize your vaccine protocols for each litter of puppies. Now, what happens with one litter of puppies out of the same bitch is going to be different a year later. So you can't assume that what happened one litter is going to be the same, because it's not. Every dog has different times that their immunity drops, different times that it rises because of exposures. So every litter, if you're going to do this, needs to be done. So if you have dachshunds or pugs, dogs that tend to have an allergic reaction to vaccines, you may want to do this rather than doing vaccines as frequently, because now you know exactly when the puppies need to be vaccinated. So if you go to this website, pull off the form, there's a PDF, you can print the form, take it into your vet clinic, mark the little box that says nomogram, ask them if they will draw blood on your female, and if they won't ship it, ask them if they'll spin it down and let you ship it. Then you can send it to her lab and she will tell you when to vaccinate your puppies. It takes 4 days once the sample gets to the lab to run the test. It's a 4-day test, and then she can customize your vaccine protocols. It's super cool. Now, there are some breeds of dogs that don't respond well to vaccines. Sometimes it's by breed, sometimes it's by individual. Most commonly, it's going to be Rottweilers, Dobermans, and the Pit Bull Terriers that don't respond to parvo vaccines like other dogs. And it can be up to 10% of the dogs. So it's pretty significant. And it's important that you know that, because if you have one of these dogs, then you're going to need to either booster them with a different company's vaccine so we can see if they'll respond to that. And I have had dogs do that. or this dog needs to be kept in a pretty isolated lifestyle where they don't go to the dog park and they don't go to the rest stop and they don't do some of the things that other dogs do if they don't develop immunity to these diseases, so that they aren't a 5-year-old dog that ends up with parvo. So it's important that, again, you know that, but if you have a dog that doesn't respond, give it another try with a different company's vaccine. And I have had Australian Shepherds, I've had Golden Retrievers, I've had all kinds of dogs, most recently a Border Terrier that simply didn't respond to the normal vaccine. So those dogs need additional boosters. All right, parvovirus. So you have a puppy, it's sick, it's got vomiting, diarrhea, there's blood in the stool. What other diseases could we have? What other things should we be looking for? It could be coronavirus, it could be distemper virus, it could be parasites, it could be a foreign body. It ate a piece of a towel, it ate a piece of bedding. It could have had intussusception where the gut kind of accordions on itself. It could have gotten into a toxicity. So all puppies with vomiting and diarrhea don't have parvo, but all puppies with vomiting and diarrhea are parvo suspects. So if you have that, you want to call your vet clinic and see if they want you to take the dog into isolation before you come in. See if they have the parvo antibody available. If they don't, find a clinic that does. So there's definitely options that you have. So Elanco is running a big campaign. They want to save 1 million dogs from parvo in the next 10 years. So they're doing a great campaign of helping people with parvo. If you do have parvo, if your vet clinic reports that you have parvo, they should be reporting it to Elanco so that that can be tracked. I was told today by a client that they are seeing it in Massachusetts now, where they previously had not seen it in those more urban areas. So parvo season is always worst when it's certain times a year. Depends on the weather. It depends on the season. A lot of times at Christmas, we see a lot of dogs being imported into the country, sometimes legally, sometimes not, that are coming in from Mexico and some of the island countries. So on the southern border, Florida, Texas, Arizona, a lot of times we'll see a lot of parvo in those areas because of the transport of dogs. But parvo is a pretty bad disease and we need to be able to get ahead of it and manage this. So we want to save 1 million puppies with parvo vaccine and with parvo treatment by 2030. So in 6 years, that's Elanco's goal. That's a pretty ambitious goal. So be aware that all those things are going on. Shelley, let's finish it up.
Yes. We do have a few questions here, so we'll get through a few of them here before 2 o'clock. But then we'll take your questions and we'll send them to Dr. Greer, and she will reply, and we'll send an email probably next week with all of her answers there. So whatever we don't get through. But in the meantime, again, visit us here at Revival Animal Health for those vaccines. A lot of those vaccines Dr. Greer was talking about, the parvo prevention products, we sell a lot of that. So scan that QR code there or visit us at revivalanimal.com.
Right. We've got the disinfectants, the dewormers, all the stuff.
Right. Again, just a reminder, auto ship, if you do find, a vaccine that's working, the disinfectants, all of those types of things, put them on auto ship. That way you don't have to worry about running out. You'll always have it on hand. It'll just be automatically delivered. And a lot of those products you can get 5% off when you put it on auto ship. So, hey, why not do that? And just a reminder, if you've joined us before in other webinars, you've probably heard we do have Revival bundles. A lot of our bundles have to do with, well, they save you money for one thing. It's a lot of products that you buy as a bundle. One of them there is the puppy vaccination and microchip bundle. So if you are looking to get, the vaccine for the parvo there, and then the microchips as well. There you go. Save there. And just a reminder, our next Okay, and if you like learning from Dr. Greer, she is an author. These are 2 of her books. She has written one on canine reproduction and neonatology, and the other is Your Pandemic Puppy. So make sure to check those out as well if you haven't already. They are both available for purchase at Revival Animal Health. So check out our website for those as well.
Right, and that does have the new protocols for vaccine in it, the Pandemic Puppy.
Okay. Great. Okay, so we do have a few Q&A questions. We'll do a couple here, and like I said, put your questions in the Q&A, and whatever we do not get through right now, I will send to Dr. Greer after the webinar ends, and she will write her responses, and I will send everybody an email, hopefully next week, with all of the answers to all of the questions, because a lot of people have the same types of questions. So we'll just send all the questions to everybody. So Pam and Barbara are both kind of wondering at what age or what is the earliest that you can vaccinate for parvo?
Well, the labels on the products say 6 weeks. in a high risk exposure situation, a shelter where you've already got parvo, it may be earlier, it may be at 4 weeks. I was listening to a shelter medicine class the other day, and they're vaccinating even younger than that. Typically, you don't want to do that. Typically, they're going to still have maternal antibodies. If their mother was adequately protected, they should be as well until they're at least 6 weeks old. So I would try not to do anything under 6 weeks unless you have a very high risk situation. If that's the case, please call and I'll talk to you. Please call and talk to one of our care specialists, and they'll get a message to me. I'll call you back.
Okay. Teresa's wondering, are there multiple strains of the parvovirus that would impact the effectiveness of a vaccine?
They generally, you only use one strain. Most of the companies have the same one. There is one company that's a little bit different, but most of the time they're the same strain, and they're going to give you good cross protection.
A lot of people wondering about that new antibody you were talking about. They're wondering, is it available now? Is it available in
Yes.
Canada? We've had a couple people ask, is it available in Canada? Do you know
I
how much
think,
it costs? Like what?
yeah, according to what I was told, I think it's only available in the US. A vial that treats a 10 pounds of dogs or 11 pounds of dogs. So if you have 10 1-pound dogs or one 11-pound dog, it's about $400 for that, plus the catheter and the other supportive care. So it's not just straight up. But if you have 10 1-pound puppies, it's still $400. If you have one 11-pound puppy, it's $400. So it depends on how many puppies you have and what size they are. And what if they're all sick at the same time, then you can treat them all simultaneously, because once the vial is made up, you can't keep it. You can't refreeze it. You can't keep it. It is not available outside the United States at this time. It does have a conditional use permit still in the US. So if you live close enough to the US, you could drive to the United States and get treated. But right now, Canada, to my knowledge, does not have this available.
Okay. Barbara's wondering, if you have a puppy with parvo, how much risk of contracting parvo do vaccinated older dogs have?
Very low if they have good protection. And that's a good reason to say every now and then it's not a bad idea to do a titer on your dog to see how they've responded to vaccines. So when you're going in for your heartworm test or your progesterone test or whatever, heck, just have them draw a little extra blood and send it into the diagnostic lab. The lab at Wisconsin will test, even if it's not a pregnant dog, you can do a titer on that dog, and it's under $100. It is not an expensive test. And it's not a bad idea just to spot check some of the dogs in your kennel, because, or especially if you've had an outbreak of something and you can't figure out why, it's a really good idea to test some of those females and see, are they producing enough immunity to send up to their puppies? Are they responding to vaccines? At one point, I had one dog that did not respond to any vaccination for parvo. And Dr. Schultz, who used to run the lab that Lori Larson runs now, he was the immunologist at Wisconsin. He said, don't even breed her, because she's going to produce puppies that can't respond to vaccines. You're going to have a whole line of dogs that are unable to respond to vaccines. So there are no responders out there in the population. And the only way to know is either expose them and find out if they get sick, which is a terrible idea. That's the chickenpox party theory, or to do a titer, a blood test, and it's not that expensive.
A couple of people are wondering about different disinfectants. Somebody's asking about Kennel Sol, somebody else asking about Virkon. Are those both good choices for parvo?
Yeah, I have used a lot of chlorhexidine with good success. The quaternary ammonias, like Parvosol, are not as good as you would like to believe. So I would suggest that you go with the hydrogen peroxide based, the rescue product, or bleach. Bleach is a lot harder to work with because you're going to end up with it on your clothing. But the peroxide products are the rescue product itself. It does a fabulous job on parvo.
Lindsay's wondering, do you recommend a nomogram for a non-high risk litter or breed, or just follow a normal vaccine schedule?
It depends on how hesitant you are to give vaccines. I have some clients that are like, I will not vaccinate. And I have other clients that are like, yeah, sure, just go ahead and give 3. So, it really is a personal decision. You're going to get good protection most of the time from either approach. But I have some clients that are very, very vaccine averse. And so if you are one of those people, use the nomogram as your tool to determine exactly when to vaccinate.
Okay. Bernadette says, if we have dirt yards, how do you disinfect for parvo or other parasites like coccidia?
Yeah, you can't. You need a flamethrower, and don't burn down your kennel or your house. I mean, literally, there is nothing you can disinfect dirt with.
Um, Cindy's wondering what would be a good protocol for rural shelters when there's questions on possible parvo other than the fecal test. She has three very rural shelters in southwest New Mexico and has had a difficult problem handling the parvo and distemper issues
Sure. And I
there.
just listened to a webinar yesterday that was done on this very topic. It was quite good. If she emails me or calls Revival and they'll send an email, I will send you the link to that. And it talks about breaking up your shelters into three groups: the recently exposed, the not exposed, the dogs that are sick, how to color code those, how to vaccinate dogs as they're walking in your door or before they walk in your door, how to shut down your shelter if you need to because of an outbreak so that you don't put other dogs at risk. There's a lot of really good information on that webinar that's more shelter based than what I was able to do today, but I'm happy to send you the link and you can listen to it. It's a 1 hour, very well spent.
Okay, so call that number, ask one of our animal care specialists
And
to
I'll
reach
get
out
back
to
in touch
Dr.
with you.
Greer and they'll get that from her. And write down that QR code, Parvo25. Okay, if you don't already, again, text messages, scan the QR code, text Revival to 23551. I really encourage you to do that. It's a great way. Then you don't miss out on anything. It comes right to your phone. And if you do have an additional questions, like if Dr. Greer said, hey, call us, seriously, call us. Our animal care specialists are there to help, and they are here to help answer any questions you may have. So please give them a call. And follow us, and like our posts on social media. We'd love to hear from you. So make sure to follow us on Facebook, Instagram, and YouTube. And our Learning Center, check that out again for free. It's all free. Webinars, previous webinars, that vaccinology webinar Dr. Greer was mentioning earlier, that's in the Learning Center. So you can watch that on demand. If you weren't with us live, you can rewatch it. All of those are there to watch. So scan the QR code or just look under the resources on our website and you'll find all of those there.
And we have handouts both for the vaccinology, the parasitology, and for the parvo. So I wrote a 3-section handout on parvo. So please take advantage of those things.
Yep. Yeah. We have a lot of resources there, articles. If you just search Parvo on our website, we have all sorts of articles that Dr. Greer mentioned there on Parvo as well. So thank you again for joining us today, everybody. Thank you, Dr. Greer. So much great information as always. We always take advantage of all of the great information you have to share. So please give us a call if you have any additional questions and have a great rest of your day.
Thanks, everybody.